You really have to look down on what's good to the individual, because you can name every food under the sun, and I've seen it flare somebody up,
Yep.
and it makes no sense, but it does for them. Just the variability, the difference from one autoimmune patient to the next is so different, because healthy people don't have to be on all these medications, and over 90% of my patients are drastically reducing their medications, and 100% of them are at least decreasing it to some degree. So yeah, you're going to have a conversation with your doctor and saying, hey, my goal is to get healthy. I've never met a patient that gets healthy and thinks, well, I shouldn't have invested in my health. I wish I was still sick and paying for my disease. That's the most illogical thing I've ever heard in my life. But people are just going to have to buck up and realize, depending on their health insurance, to get healthy is completely, in most cases, completely pointless.
This is Dr. Sarah DiFrancesco, and you're listening to Health Geeks Radio.
So we just want to add some value to everyone. We want to make sure that people understand what functional medicine and the value that it adds to their life, and go over some of all the myths, the truths, the what we do in functional medicine, because it's a term, but some people are just like, what does that mean? So I'm joined here with Dr. Will Cole of drwillcole.com, which is a great website, very beautifully laid out, because I am a website kind of guy. And really nice to meet you again, part 2 of our interview. First one is lost in the formatted SD card land. So we're going to make this one just as good, if not better.
Yes, better.
So I guess we gotta.
Thanks for having me.
Yeah, it's really cool to have you on here, man. You are a really, just a cool guy, because it's like you're putting everything out there. Your website looks great. You're putting a lot of information out there, and doing functional medicine. So give a brief introduction about your little history of everything, because you are a chiropractor and then went to the functional medicine route. So I think that's where a lot of people they start off in a certain specialty and then move to the functional side. So talk about the move.
Yeah, so my doctorate is from Southern California University of Health Sciences in Los Angeles. It's actually where Datis Karazian went to, who's one of the, I think, one of the best functional medicine practitioners in the world.
Datis is, yeah, he really is. I have all of his books, his brain books, his thyroid books, and he is the man.
Yeah, so our school was really integrative anyways. It's kind of really clinical based, and as far as labs are concerned and training is concerned. And then my postdoctorate is in functional medicine and clinical nutrition. So that's what my practice is. And yeah, we see patients in Pittsburgh, Pennsylvania, and we do virtual functional medicine consultations via webcam and phone consults for people around the world. So I'm so blessed, and I love what I do, and having people all around the world get healthy through functional medicine is really a blessing for me and a blessing for them over as their journey into health unfolds.
Yeah. So when does someone kind of need a functional medicine person? I guess that's a good place to kind of begin with.
Yeah. Well, there's two camps. I think most of the people I see are people that have tried everything else. They've gone from doctor to doctor. They've gone from every specialist under the sun. They've gone to the Cleveland Clinic, and now the Cleveland Clinic has a functional medicine center. But before they had a functional medicine center, and they've tried everything out there, and nothing's changed but their prescription list and their list of doctors. And functional medicine really was the solution for these people to find out the root cause of why they're sick. A lot of our patients have autoimmune problems. Many have hormonal problems and brain and gut problems. That's kind of where I specialize in. And, we're seeing people that have tried everything and are sick, and they don't want to be sick anymore, and finding out the root issues of why they're sick, giving them answers, and then giving them solutions to rehab them into health. And then ultimately they can do it on their own, where I don't have a patients for life. I just focus on getting them healthy. And then they go back to their PCP for regular checkups. But other than that, they don't need all these millions of specialists, because they're healthier and they're stabilized and they've got their health back on track. But then I get a few patients, not a lot, of the people that just want to optimize their health. So I don't want to say that, just functional medicine is just for really sick people. I think it's also for the people that just don't feel their best. They have brain fog. They have maybe just a mild depression. They have fatigue. I get a lot of patients like that too. I think it's human nature to wait till people are really sick. Wait till you're really sick, then do something about it. I think that I would love the type A personalities to just take care of their health before it gets that bad, but it rarely happens. So maybe I'm saying this right now to encourage people, like, if you don't feel your best, it's not just because you're getting older. You might want to find out what's going on in your body and then do something about it.
Yeah, and I think, how do you know if you're looking for something like this is if you're the, the new term is the biohacker, or the people that are always looking for the next little edge. And if you're looking for the supplement to give you a little extra energy or sleep better and stuff like that, maybe this is time to kind of take a look at some of these factors and see where we can optimize for sure.
Yeah, I think, and we have a camp of people that do that. Obviously, in the paleo world, in the health sort of CrossFit world, they want to optimize their health, and labs are really the only definitive way to do that. So getting the proper labs run, find out, okay, well, how's your body running, and then optimize that function of their body.
Yeah, we'll definitely get into some labs. That's what I love about functional medicine too, is like, it's not this just woo-woo kind of stuff where it's like, oh yeah, you should feel better. It's like, no, here's marked results, and here's what you can look at the change in the last 3 months, and that's fantastic.
Yeah, absolutely. I love obviously we want to see them improve and watch their energy get back and their weight come off and all of these biomarkers improve in their day-to-day life. But yeah, the big objective report card is that lab. You cannot deny the fact that when you see these lipid panels improve, or these triglycerides come down, or the hormonal panels improve, this is working, and we're getting people healthy.
Yes. And we'll get into those labs in a little bit, but you also have some ebooks on your website: Heal Your Hormones, Heal Your Gut, and Heal Your Autoimmune Conditions. So, I think I want to dive into some of these. That, like I said, even in the first interview, we had a lot of topics to cover, and might have to do a part 3 now, I guess it would be. So let's start off with the main one that is super chronic and misdiagnosed too is the autoimmune factor. And I know you discussed the 4 factors to the autoimmune storm. So let's go into that a little bit.
Yeah, I mean, autoimmune conditions are a huge problem in the West and around the world. In the United States, they're the 3rd leading cause of death and disease, and they're widely underdiagnosed. People have these unexplained symptoms. They go from doctor to doctor. To be diagnosed with an autoimmune condition, it's very difficult in those cases, and people go for years of their lives not knowing why they're so sick, or they're going through their health problems. And typically the diagnosis criteria is you just have to get so bad and so sick and so much tissue destruction to finally be labeled with an autoimmune disease that it's just abysmal. And functional medicine, I think, really fills the gap in for autoimmune patients, and most of our patients are autoimmune patients. When you're looking at the epigenetic or environmental factors of the rise of autoimmunity, we are seeing that around 2/3 of the autoimmune puzzle has to do not with genetics, but the world around you. So your stress levels or lack of stress levels, or the foods you're eating or not the foods you're eating, or exposure to toxins, chronic gut issues, viral infections, bacterial infections, all of these are, the imperfect, unfortunate storm that gives rise to chronic autoimmune conditions. So we run labs to find out what is triggering, what is flaring up your immune system, causing your immune system to attack whatever tissue it's attacking, whether it's the brain or your thyroid or your joints or your gut or whatever the case may be. A lot of our patients have polyautoimmunity, where they're having multiple autoimmune processes in their body, and most autoimmune diseases have a 50 to 70% risk of getting, God forbid, another autoimmune disease. And finding these out, you may be labeled with one, but when we run the antibody test, your body's actually attacking more things than you're labeled with as far as what you think you have. So we have to know what's going on here. And kind of the big cornerstone of finding out triggers for autoimmunity is dealing with the gut and dealing with the microbiome, where 80% of your immune system is. So looking at that at large, the levels of the bacteria, ruling out leaky gut syndrome, any yeast, fungal overgrowth, parasitic infection. These things are typically a huge factor in dealing with these triggers of autoimmunity and then the downstream effects of this sort of systemic inflammation gone wild.
Yeah, it's the inflammatory cascade. So let's say I'll give you two scenarios. If I'm not diagnosed with anything, but I'm having these weird symptoms, this is exactly what we were talking about before, like, I'm not sleeping good, or I'm having these weird things going on, feeling tired, not pooping, all that stuff. Is this something that could, could be beneficial to check out?
Yeah, absolutely. I think that anybody that has unexplained symptoms, or maybe they have one autoimmune disease, but they're still not feeling great, they need to run labs through a functional medicine practitioner. Again, we run them for people around the world. Cyrex Lab is kind of my go-to resource for clinical information for autoimmune patients or unexplained autoimmune spectrum type cases where they may not be sick enough to be labeled with an autoimmune disease, but it's like in the making, and it's their immune system is going out of control to some degree.
Yeah, and you have to have 90% tissue destruction and then finally go out of range on your labs to finally go, now we see what's going on. It's your thyroid. Oh my gosh. Yeah. And you're like, well, I've been tired. I've been this. I've been, like losing my hair. It's like, hello, had no one listened to that one?
Right, exactly. It's just abysmal. And I would say the same. We see a lot is Addison's disease is really rare as far as clinical prevalence, out there statistically. But on labs, we see raised antibodies against the adrenal glands very frequently on Cyrex labs for patients around the world. So, they're just not sick enough and their body hasn't destroyed their adrenal glands enough for them to be labeled with Addison's disease. But who wants to wait that long anyways? At that point anyways, it's too late to really regain your health fully. So be proactive. Don't wait until your doctor finally says you're labeled with an autoimmune disease. Do something now. This is your life, and you can't depend on a doctor who's only going to give you steroids or immunosuppressants anyways to do something. You can't depend on that system for your health. Take responsibility for it. And I think that's the real message that I want to get out there for people. And I think the message that permeates functional medicine is that ultimately a functional medicine practitioner is going to clinically investigate this, give you tools, and coach you and clinically monitor you, all of that. But their goal, if it's a good one, is to get you healthy so you can move on with your life and not just seeing you for decades.
Yes, absolutely. We're like the coaching of back to health, or the next step of health for sure.
Yeah.
So like, let's say, I was wondering this too, actually. We did have Dr. Chad Larson on Cyrex. He talked all about the Cyrex labs in our first episode. If you run that Array 5, where it's the Array 5 test for a bunch of different antibodies to different tissues that, could be, it's predictive autoimmunity, like thyroid, this. When you see that your body's starting to pump out some of these antibodies, can you do something to really take hold of that? Like, is that a good outcome to, like, hey, if I make these changes, then I won't have these symptoms in the future?
Yeah, I see that in the clinic all the time. It depends on what degree how long they've been sick or what their symptoms are, as far as how much has this been triggered, how much has this been manifested in their life as far as tissue destruction. But generally speaking, if someone catches these things early, it's relatively easy. It's not a quick fix by any means, but it is. But it's a lot of pain that they don't have to go through, and a lot of suffering and struggling they don't have to go through by dealing with these problems early on. Or it's better late than never for anybody. So I would say that to dampen the inflammation, to deal with these underlying microbiome issues is paramount to them recovering their health. So yes, absolutely. There's so much you can do naturally through functional medicine to start to regain your health.
That's cool, because it's like putting money in the bank, and you don't have to worry about cashing checks. You can't cash, or was it writing checks you can't cash? That's what it is.
Yeah.
So now, what if you have an autoimmune? You've been diagnosed, let's say, type 1, GAD antibodies, type 1 diabetes type stuff. Should you still work on your gut microbiome and everything else to prevent flare-ups and all that? Is that a clinical significance?
Yeah. So, if you're diagnosed with one autoimmune disease, let's just say it's type 1 diabetes, and your C-peptide is low, you're not producing insulin on your own. There are cases, and I've seen cases where people have regained enough beta cell function where they could get off of insulin. I think that's rare, but I think ultimately what you have to look at is your risk factors, your quality of life, and ultimately dampening and modulating the immune system so you don't, God forbid, get another autoimmune disease. So there's still so much you need to do. If you're diagnosed, it's not like, well, I just have to throw my hands up. I'm just destined to be sick and continue to get sicker and keep injecting this insulin. I know many type 1 diabetics, after they go through a functional medicine program, that are on extremely low amounts of insulin, way less insulin than a lot of type 2 diabetics that are walking through blindly in the standard model of care. So there's so much you can do to decrease your cardiovascular risk factors, decrease your inflammation, modulate your immune system, balance your immune system, so you don't get another autoimmune disease, or at least decrease the chances of it happening. So there's it's a message of hope. So if someone knows, hey, I have been diagnosed with an autoimmune disease for decades, there's nothing I can do. That's not true.
Mm-hmm.
It's better late than never. Get involved with functional medicine and find out what your options are, because there's a lot.
Yeah, that's a value message right there. And if you could probably stop listening right now, but that's your value message right now. But let's go into some other topics of like that gut stuff. Leaky gut, autoimmune connection. Let's talk about that, because
so
like 5 years ago, man, I think this was a topic of like, no, that doesn't exist and it's fake, and now it's like, no, this is actually legit.
Yeah, I know. We've been vindicated. So it's like science is catching up with antiquity. I mean, Hippocrates, the father of modern medicine, said thousands of years ago, all disease begins in the gut. And now research is kind of estimating that, well, around 90% of all chronic disease begins in the gut, and many autoimmune diseases too, at least in component. I would say mostly all of them at least have a gut component. And some entirely, some researchers say it's a precondition for autoimmunity, is that hyperpermeability of the gut lining, where things are passing through the gut lining that shouldn't be passing through, and they're causing molecular mimicry, causing the body sort of tagging these bacterial endotoxins, lipopolysaccharides, or tagging food proteins with antibodies, and then starts attacking your own tissue. And that's the seminal event of autoimmunity. That's one pathway that can happen, where I think it's very common, and it's not looked at in the standard model of care at all. But there's no medication for it, so why would they look there?
Mm-hmm. So what are you saying about like all the stuff that's coming in? It's like the gut lining just gets, food and food particles or bacteria particles are coming in when they shouldn't have come in already. We talk about like the gut lining like a screen door, and it allows air in, and then when you have leaky gut, it's like a kid poking his finger through the screen door, and then stuff comes in like the flies and everything when they shouldn't be coming into your house. So
right, and that's that protective barrier. And something that I've written about recently on my website is a leaky brain, where I think that's kind of the next end of that problem. And you're going to have elevated zonulin or nucleotide antibodies, which are these proteins that dictate your gut lining permeability. And when you have raised antibodies against that, you're going to have increased permeability of the gut lining. And that same zonulin nucleotide sort of gatekeeper in the gut is found in the blood-brain barrier. So very, very common for us to see on labs is increased blood-brain barrier permeability, at least in the population of people that we talk to. So it's an amazing phenomenon for me to look at the leaky gut issues, to look at the leaky brain issues or the blood-brain barrier permeability issues in people that are dealing with autoimmune issues, and I would say strictly brain problems, or what's labeled as a strictly brain problem, like anxiety, depression, ADHD, autism, brain fog, all of this stuff. They're just labeled with these things. And they just say, well, you're just depressed, or you just have anxiety, you just have brain fog, or you're just getting older, whatever the excuse is. But ultimately, we have to ask the question, why? It's not a pharmaceutical deficiency. That's not why you're going through what you're going through. So running these labs is remarkable to give people answers. And I get like it's just an excitement every time, where obviously I don't want to tell anybody they have a problem. But when someone wants to find out why the heck they're going through what they're going through, it's a moment of bittersweet joy, because at least they have an answer. At least they have, wow, like this is actually what has been going on in my body for so long, where it's at least the start to something great.
Yes, and especially with the blood-brain barrier stuff, in the book Anatomy of an Epidemic by Robert Whittaker, I believe it is. I have it on my Audible. I got diagnosed with ADHD and all that, and it really is the outcomes is like, okay, just take this and you'll be okay. And it's just like insulin. Like whenever you feel depressed or need more motivation, you just take this as needed. And, it's just like diabetes. I'm like, huh, that's interesting.
Yeah. Yeah. I mean, so the microbiome's a huge factor. I think everybody should have it looked at. It's just a huge foundational system. Not just with autoimmune. We're talking about autoimmune, but really any health issue. It should be ruled out at least. Just ruled out. Look there and ruled out. Is it a factor to my problems?
Yes.
Because a lot of people think, well, if I don't have gut symptoms, then it's not me. Like, oh, I don't have constipation, I don't have diarrhea, I don't have IBS, so I'm good, I'm fine. Many of these gut underlying microbiome problems do not come with any gut symptoms. You're seeing the downstream effects of an underlying gut problem. So anything from the brain to the hormones to weight loss resistance, all of these are linked in the medical literature to microbiome problems. They're not gut problems. And even if you look at autoimmunity, the obvious one that everyone thinks about is celiac disease. Most autoimmune celiac patients do not have the classic gastrointestinal symptoms, and it can be a strict neurological problem where they're having transglutaminase 3 and 6 raised antibodies against that, and it's affecting their brain, and they're labeled as anxiety and depression or bipolar. So yeah, these questions have to be asked. The underlying functional issue of why they're going through what they're going through has to be looked at, and then they can start dealing with their problems.
Is this a valid thing to look at too? Is stress can affect something like what's called like secretory IgA, and that's like that mucus lining like in our nose and stuff that lines our GI system too. And when you're under heavy stress, that mucus lining can decrease and cause more propensity to have the leaky gut stuff. Is that true?
Yeah, absolutely. It's linked in the literature. I just actually hyperlinked that PubMed study on my last leaky brain article on the website. Actually, it's on mindbodygreen.com, but it'll be on my website soon. Okay. So it's acute stress, chronic stress, stressful life events have been linked to triggering autoimmunity, and that's one mechanism that can do that, can damage the gut lining. And it's linked to an increased rate of a lot of autoimmune diseases.
Yeah, so what that translates to is just because you don't have GI issues and your diet's pretty good, but let's say you have a dramatic change in your life and then it's like all these things start happening. That was usually the method of action for that flare up in this storm that you're experiencing. So stress is definitely nothing to be downplayed. It's definitely a factor in managing your symptoms as well.
Yeah, absolutely. And there's one study that I referenced in my ebook that talks about the majority of these autoimmune cases had a significant stressful life event the year prior to their diagnosis. And that's something that I see very common in my clinic, is that they went through a horrible divorce. They lost a loved one. They were a caretaker to an aging parent. Some stressful life event that caused their health to significantly decline. It was that trigger. It was that tipping point that caused the autoimmune storm to happen. It was that straw that broke the camel's back in many cases. So yeah, it should not be underplayed. And I'll tell you one thing, that you can deal with all the great microbiome issues and the health issues and get someone radically healthy from a food medicine and herbal medicine standpoint. And if you are going through stress, or you're not taking care of your emotional and your well-being, your mental life, you're going to it's going to be really difficult to get you healthy, very difficult. It may be possible, but it's going to be despite the stress, not because of it, because the stress is such an impediment to people getting healthy.
Yeah, and that causes that bouncing around from doctor to doctor, even alternative doctor to doctor, because it's like that is the underlying thing for sure.
Right. So, I mean, it's where I typically will sort of integrate mindfulness, breathing exercises, yoga, tai chi, something to sort of get into your daily practice or weekly practice at least, to start breaking that stress cycle.
Okay. So what if we've gotten kind of like this leaky gut thing going on, what do we do now? Like what's like the next steps for this?
Yeah, so I would say first find out if you have it, because a lot of people go to Google and think they have it, but I would find out definitively on a lab, do you have it? And I mean, no lab's perfect, but we can know with pretty good clarity if it's an issue. So I would combine health history, diagnosis possibly, with lab results to kind of say, okay, is this a factor for you or not? And then start healing the gut. So we're going to have to, I mean, that goes back to other Cyrex labs that I would use. It's the cross-reactive panel and the gluten-associated foods panel, as well as the food immune reactivity panel, to kind of find out, okay, you can eat the best things in the world that are like the best real food, clean eating food in the world, but it's causing inflammation in your body. So the biological variability out there, like what works for you isn't going to work for the next person, and vice versa. These labs can really shed light on, why you're not getting better and you've tried everything and you're eating clean and you're still sick. Removing these foods really does speed up. What I've seen clinically is it speeds up the healing of the gut. I sound like I'm getting paid by Cyrex, but I really am not. But it's just that great, and it's helpful from a clinical standpoint for me to take a lot of the guesswork out of it to really pinpoint exactly what's going on here. So we use a combination of food medicine, intermittent fasting protocols, and botanical medicines to help heal the gut over the course of time.
Yeah, I agree with the Cyrex thing too, because I use Cyrex a lot, and we had them on our podcast, and I'm like, oh my god, I feel like I'm just like the sponsorship for them, but in all reality is that they are really good at this, and they provide the data. They have Dr. Vijdani and like all these people giving seminars, and it's just like, man, they can back stuff up. And yeah, I totally agree that no lab's gonna be 100%, and yes, there's variances and stuff like that, but like, man, every single time I've run like some of these really in-depth labs, it's been pretty spot on for sure.
Yeah, exactly. So, and then you want to put that in context with their health history and all of that. And that's why generalities rarely help on it when you're dealing with these autoimmune cases, is that you really have to look down on what's good to the individual, because you can name every food under the sun, and I've seen it flare somebody up, and it makes no sense, but it does for them. Just the variability, the difference from one autoimmune patient to the next is so different. Obviously, if there's some general things that we all know that nobody should be doing. I mean, you should not be eating sugar, refined sugar. You shouldn't be eating junk food. You shouldn't be eating gluten. You shouldn't be chowing down on bread. That's a no-brainer. But beyond that, these cross-reactive foods and these vegetables and meats and fruits that your body can be causing inflammation in your body now needs to be looked at on an individual basis.
Okay. So now talking about the microbiome, how do we help support that? Is that just taking a probiotic, or where do we go from that?
I think it's a combination of things. It really, getting down to the specificity is a huge factor there. So I run a stool test, not from Cyrex, but it's a stool test actually from a lab near you in Illinois, outside of Chicago. And it's a 2-day, 3-day collection, depending on the case, doctor's data where I run, and looking at the microbiome. So predominant bacteria, levels of these colony-forming units of specific type of strains, and then any yeast fungal overgrowth, and then looking at that immunology response and the digestion, absorption, and inflammation, all that stuff. So the variability of the microbiome is very different. So if you see like no growth of specific good beneficial bacteria, I get really specific in really re-inoculating the microbiome with what's lacking in that specific person's microbiome. And that's not going to be necessary for someone who has plenty of that other bacteria. So I think general sweeping things can be good, and some things will stick and it'll be good for you. But for people that aren't getting better and they've tried things, they need to really look at these underlying issues to find out what's right for them. So yeah, we get down and find out what's actually in the microbiome and try to balance it out where it's having issues. And if there is a bacterial overgrowth or a bacterial infection, then we use natural antibiotics, sort of oregano and caprylic acid, pal de arco, these type of things to help starve down that bacterial overgrowth or yeast overgrowth that's causing these autoimmune issues or neurological problems, whatever the case may be.
Yeah, and there's research saying that changes in the gut microbiome can even change your mood and how you release things that are like your serotonin that relax you, and then you're feeding the bad guys, and it causes a big storm.
Yeah, I mean, there's so many exciting so much exciting research coming out looking at different strains and their implications to the body. Again, many times not even stomach, gut, intestinal issues, but downstream brain problems or hormonal problems or weight problems. So, I mean, low levels of specific strains are correlated in the literature to depression, anxiety. I mean, who would even think of looking there? Definitely no one in the mainstream model. I mean, you're going to get a Prozac or something like that, but really it's largely due to the second brain, which is your gut. I mean, 95% of your serotonin is made in your gut and stored in your gut. So looking at the second brain to deal with these brain issues and autoimmune issues is a imperative place to look.
Cool. Now, supplementation for everything too. Is there some good recommendations that you have? I think in your books you kind of give some general things that people can start doing, right now and get back onto that.
Yeah, I definitely want to work on that T regulatory cell, sort of balancing the immune system, dampening inflammation, getting good turmeric and resveratrol. Again, I can say these things and say that they're great, but we test them on Cyrex and they come back as immunoreactive, inflammatory for some people. So I don't want to make generalities for any autoimmune patients because they can cause more problems unintentionally, but for you, they're not right. So I have actually a patient in Michigan that I'm just thinking about just this week. She can't be on all these things that I would use to dampen inflammation because it came back in the lab as being a problem. So there's always exceptions, but generally speaking, dampening inflammation with herbs and botanicals is a good start. Getting your fat-soluble vitamins like A and D and K2. And, there's a great probiotic that I started using on a lot of my patients called Megaspore. Mm-hmm. It really is a pharmaceutical grade probiotic that I've seen good success with a lot of autoimmune patients. I don't give it to everybody, but it definitely is a factor, a piece of the puzzle for some people seeing better improvements in their health.
Yeah. And what I was trying to get at too is that it's not like once you get all these diagnoses and stuff like that, it's not just like, okay, now that we see all this stuff, there's nothing to be done. It's like there are a lot of supplementation that can be done. It's not like you're going to be on 70 billion supplements. I don't agree with that either, but there's going to be some that are very relevant for you.
Right, exactly. So I try to deal with it as much with food medicine as we can. So looking at the nutrient deficiencies, looking at the microbiome, and then looking at what is found to improve these issues using your meals as medicine. So that's my primary go-to. And then we fill in the blanks with a few condition-specific natural medicines that we're not really getting in the right amounts through food. It's predominantly food. Predominantly avoiding the foods that flare you up and eating the foods that are good for you and they're healing these problems, and then a few targeted natural medicines. And my philosophy is similar to yours, I think, is that as you get healthy, you can get off of a lot of the natural medicines too, other than a few things that you may be on forever, but nothing major. So that's a lot of people's concern, and the question I get on almost a weekly basis. Well, am I going to have to be on these natural things now that after I get healthy? Well, no, largely speaking, no, with a few exceptions, and they're not even things that you would actually get from a doctor. You could just pick up in a store or order online. Mm-hmm. But if it's logical that if it's helping you and it's healthy and it's just a food medicine in a form of a capsule or a powder and it's supplementing something that you're not getting through your foods, that's logical and it's not causing you side effects. It may be the best thing for you, Yes.
That is for sure. So so it sounds like that's a great kind of holistic approach for your autoimmune conditions for sure. Now, you should be. I tell patients too to tell your doctor that you're doing these things because sometimes you also have to have medication adjustments for sure. Because
absolutely,
yeah. Because some patients, I don't know why, but it's like, I haven't told my doctor I'm doing acupuncture or working with you. I'm like, you should probably tell him that it's happening because we're going to make some changes for sure.
Yeah. I mean, I always say this to my patients is that another word for functional medicine is integrative medicine. We want to integrate your doctors into you getting healthy. We want them to be involved in you getting healthy because guess what? As you get healthy, chances are you're going to have adjustments in your medications because healthy people don't have to be on all these medications. And over 90% of my patients are drastically reducing their medications, and 100% of them are at least decreasing it to some degree. So you're going to have a conversation with your doctor and saying, hey, my goal is to get healthy, and I'm if, what doctor can be against their patient wanting to get healthy? And if they have a problem with that, get a new doctor, because that's not right.
That's true.
Ultimately is that, this is your life. This is your body. If you want to get healthy, this is your right. And I think a lot of times people get afraid of offending their doctor. You're not going behind their back. You're just getting healthy. And if they have a monopoly on you not getting healthy, this is a problem. So you kind of have to have a conversation. This is my goal, getting healthy. Have an open door policy. We send labs over to their PCP so they can make adjustments. It's typically overwhelmingly a positive experience, with a few exceptions of their PCP not understanding it, which is fine. If they want to have a conversation about what health is, we can have that conversation. But I prefer the patient to have a conversation with the prescribing doctor and say, this is my goal. My goal is to get healthy. This is a positive thing. It doesn't have to be this secretive, going behind your doctor's back thing. This is a positive thing. Yeah.
Any alternative person, it's not us versus them. It's not this like Illuminati BS stuff where it's like crap like that. It really is like a good conversation and working with a good doctor that's open to this. And if they're not, maybe they're just old school and they're not working out for you. So the common question I always get, I don't know how you answer this one, is like, well, why does my doctor do this? Can he order these labs?
Yes, I get that question all the time. And really what it comes down to is that the labs that they're running are adequate if all you're giving out is medication. So you don't have to run all the labs you're running like you would in a functional medicine setting if the end result is still that pharmaceutical that you're already on or that he or she wants to put you on. So it's not that your doctor's being negligent or your doctor's not smart. It's that ultimately the end result is the pharmaceutical. That's their only option for you anyways, other than going from one type of pharmaceutical to another company that sells a similar pharmaceutical. That's their only option they have, is to diagnose a disease and match it with the corresponding drug. So it's not that these functional medicine doctors just know so much more and they're running things. Why wouldn't my doctor run these things? It's that our training is different and our options are greater, more varied than just one pill.
Yes. And you don't have a medication deficiency when you run a certain lab.
Right. So we want to find out the root issues of why you're on the medication or why they want to put you on the medication in the first place, so you can restore your health and possibly, and I would say in most cases, not be on the medication, or at least reduce the dosage of that medication.
Yeah, and what are the long-term outcomes for XYZ medication? Because you can only say for going back to the diabetes stuff is that I kind of want to say it almost as like diabetes is exceedingly, especially type 2, I'm saying, is very, 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 very manageable.
Oh, absolutely. I think some studies show around 91% are preventable and reversible. And that's exactly what we see in our clinic and for people, in other states that we're coaching too, is that you can drastically reduce these medications, get off of them. And people just don't know that. And when I started talking about this in 2009, on a functional medicine level, just locally, people were acting like I was speak blasphemous. Like, how dare you say that diabetes is reversible? It's like, well, no, look, this is what we're seeing here on a clinical level. And then the research and then the mainstream sort of consciousness, I think, has been raised thanks to Mark Hyman, that these things are drastically manageable.
Cool. So we can find you, Dr. Will Cole. You got all your ebooks on there.
drwillcole.com. We have ebooks just to subscribers. You have to subscribe because I just want to send good quality content for people who are serious about their health. So drwillcole.com, you can subscribe there. We have a Heal Your Hormones ebook with all the functional ranges for thyroid hormones and adrenal function, all that good stuff with lab scans in there. And then the Heal Your Gut guide, and then Heal Your Autoimmune Conditions. So yeah, those are ebooks for subscribers on drwillcole.com.
Yeah, and I know I'm going to be having you on probably again because we have some other topics that we want to go over, but today we'll probably just focus on the autoimmune factors of this. Just keep that as an episode, and we got some other stuff lined up for Dr. Cole working with us too, so it's going to be good. So
I'm excited. Thank you for having me.
The man with the best hair in functional medicine is on our team.
Wow, that is an honor.
Yeah.
Thank you.
I gotta say, man, I was like, it's the functional medicine haircut. I think it's
Jimmy Moore actually said that, not the exact words, which I like that, but he actually said similar to that. Hey, you guys, I respect your opinion, so I'm gonna go with it.
Yeah, I think that's going to be your new tagline.
It's gonna take me really far. It really give me credibility. I'm so excited about it.
You know what? Everyone's saying the same stuff, so it's like about time to break out of that.
Yeah, talk about hair.
Yeah, exactly. Because we're real humans. We're not like these robot like people that just say eat organic and gluten free and go meditate on a rock. It's like we're realists of stuff, and we're strategizing to say like enjoy your life. Like this is what it's meant to be. I want to see people having the foods that they want to have, and as long as it doesn't cause symptoms and flare-ups and stuff like that, then like God bless, enjoy your life, because it's not just this regimen. I'm going to this alternative doctor that's just going to yell at me, and because I'm not drinking juices that are from the Himalayas, like no.
Yeah, I mean, enjoy life and live life, and being healthy is freedom. You know, the number one word I hear when I ask, what have you been going, what do you miss the most since you've been sick or going through your health problem? The word is freedom, that lack of freedom. Being healthy is freedom. There's nothing restrictive about that. And, you know, good haircuts is part of that.
Absolutely, yeah. So I know, and then you're on some social media too, where you can check out his hair on Instagram.
Yeah, at Dr. Will Cole on Instagram, on Twitter, and Facebook's on there somewhere too. So yeah, cool.
Yeah, and then maybe some podcasts coming up soon we're talking about too. So
yes, I appreciate it. Thank you.
You got a lot of stuff coming up, man. I'm glad to keep you in the loop and in the connection. So yeah, if you have any further questions, reach out to Dr. Cole or reach out to us, healthisgeek.com. We got our 7 Principles health book. These are the 7 principles that build like a healthy lifestyle. So these are things you cannot escape. And we go over things like the sleep, some diet, some stress management and movement, and things like those that actually build that foundation for health. So check it out, healthisgeek.com too.
Great.
All right, Will, it was a pleasure, man. Any closing remarks?
Maybe the closing remark would be this. I think that a lot of people think that functional medicine is just for the rich, wealthy 1%ers, and that couldn't be further from the truth. Every single patient we have are working class people, normal people, truck drivers, nurses, retired people, moms. I mean, this is just normal people getting healthy. So I want to just slam that myth out of the way, because it's just not for celebrities or rich people or 1%ers. These are normal people that are realizing what they're doing is not working for them, and they need to do something different to see different results. I'm from Pittsburgh, a working class city, and I see patients around the world. I look at their jobs. I look at what they do. They're all normal people getting healthy. So don't exclude yourself because you think you can't afford it, because we do everything we can, at least from our clinic standpoint, to make sure functional medicine is available, affordable, accessible to everybody. And we'll do everything we can to make sure to get you the care that you need. If we see a case that needs help, that wants help, we will do everything we can to get them the care. So just to get that out there, because I think a lot of people listen to this information and then rule themselves out because they think it's not covered by insurance, so I can't do it. And well, that's not true. And I had a patient tell me once, it's a saying, I'm sure, but he told me, depending on your health insurance for health is like depending on your life insurance for life. And he said, if I depended on my health insurance for health, I better have good life insurance. Is that ultimately health insurance is going to be great for emergency care, God forbid surgeries or ER stuff. We have the best emergency care system, I think, in the world, or close to it. But we're dead last when it comes to chronic health care, according to the World Health Organization. So as far as Western nations are concerned, dead last. So that's what we're talking about today. We're not slamming any doctor. We're just saying the system is broken. And ultimately, if you're tried every medication they put you on, you're going to have to do something different. And no one's going to twist your arm to do it. You're going to have to be the one to take responsibility for your health and do something about it.
That's true, man. I couldn't agree more. And yeah, that is something that even myself, people are wondering like, well, does this cost much? It's like, it's definitely an investment for sure. And it can really, it pays dividends. And it's not something that you have to do for the rest of your life. That just like how you're saying, like we're in the job of getting you better and keeping you better for sure.
Right. I mean, and when it comes down to it, you just have to face the facts. If you're going through a health problem, your disease has a cost.
Mhm.
You're going to either keep paying for it in the lack of quality of your life, or potentially shortened life, and then paying for the disease itself, all the medications and copays and hospitalizations, all of that stuff. You can continue to pay for that, or you can invest in your health and get healthy. I've never met a patient that gets healthy and thinks, well, I shouldn't have invested in my health. I wish I was still sick and paying for my disease. That's the most illogical thing I've ever heard in my life. But people are just going to have to buck up and realize, depending on their health insurance to get healthy is completely, in most cases, completely pointless.
I agree, very much so. Yeah, very much so. They don't.
Sorry,
No,
I'm on a soapbox with these things.
No, it's so true, man. Because they don't pay for the education piece. They pay for the visit and the medication, and that's it.
Yeah, I mean, and you could go to those hospital doctor, dietitian, nutrition classes. I've not seen one person within my clinic that actually got anything out of that, ever.
That's true. Yeah. And it's like, it's not, you didn't get here because you didn't eat something or this. It was some of the sacrifices that you made to try to maintain this kind of imbalance that you had. That's the thing. And now we got to figure out where we can kind of, improve these factors so you don't have to make those sacrifices anymore.
Yeah, exactly.
Cool, man. That was a great closing remark. I couldn't agree any more. Like, that is a great soapbox rant for sure.
I mean, because I think the people that are listening to this, they need to hear these things. These are things that people typically think about and ask about. So why not just talk about it?
I'd like to thank Dr. Will Cole for joining me not once but twice, because the first one is gone forever. So the second interview, hopefully you guys all enjoyed it. You can check his website out, drwillcole.com. I'll, of course, have that all linked up. He'll be back with some other topics that we're going to go over. And definitely check out Health Geek's website, healthisgeek.com. Grab our 7 Principles book. It is hot off the presses. It's looking good right now. So we're going over all those topics that we touched on today. So sleep, diets, movements, stress management, all that. Check it out at healthisgeek.com. Until next time, we look forward to geeking out with you. Bye-bye.